And among Black women, a greater proportion of deaths occur even after the 43 days and up to a year. We talked about the difference, the changes in the cardiovascular system. Remember, you have this massive vasodilation during pregnancy, you have this massive increase in your blood volume during pregnancy, you have an increase in heart rate, but it's primarily because of this massive vasodilation that you don't have any effect on your blood pressure. You also have hyper, coagulability, which increases clots, but in general, during pregnancy, it's okay. It's after pregnancy that these things normalize, but they normalize at different time periods. And that's what puts people at such a high, risk right after delivery. So postpartum physiology, remember, your blood vessel constricts within days. And remember, during delivery, you just had even more fluid put into your system because now you don't have that baby pressing on the vena cava. So you don't have that, hydrostatic pressure upstream, and all of that fluid, the edema in your legs can come back into your vasculature. So that, increases your stroke volume, which increases your cardiac output, which increases your pressure. But also because during uterine contractions, with every contraction during delivery, it increases your blood volume by 500 mLs or something, which does the same thing, right? Increases stroke volume, increases cardiac output, increases blood pressure. So now, relative to before delivery, you have a net increase probably in your cardiac output. And then within a couple of days, all of a sudden, all of the vasculature in your whole body closes up. And part of the way that you have this vasodilation during pregnancy is because the maternal blood vessels are relatively resistant to the effects of epinephrine and norepinephrine, so your sympathetic nervous system, during pregnancy. So you basically have this resistance to those hormones. Kind of when we talked about insulin resistance. And so you could have stress and not have the same effects on the maternal vasculature that you would expect if she wasn't pregnant. Now, you can still be bumped up and your adaptive mechanisms can be overwhelmed because we see that. But in general, that's how it works. And so afterwards, you don't have that resistance anymore. Your body responds to epinephrine and norepinephrine. And so that's going to make an even bigger deal. If you're dealing with stress in the postpartum period, your body is now capable of reacting in the way that it's designed to react because you no longer have that protective, resistance to it. And resistance, I'm talking about in this particular situation, as in you might be releasing epinephrine, but your vasculature isn't constricting until after you have the baby. Then everything within days constricts, and your body is now capable of responding to that sympathetic nervous system. That's really dangerous. And then your blood volume doesn't decrease for weeks. So you have a net positive effect on this blood pressure potentially. And then you have this coagulation status that doesn't normalize for a month or more. So, lots of blood volume, all of a sudden vasoconstriction, and think of the potential in turbulent flow and the issues related to blood clots. This is a really dangerous time. And as we mentioned before, about almost half of women don't return for that postpartum visit. And we don't really know why, but we do know that about 2/3 of low-income Black women never make it to their doctor visit. And that's much more likely if they experience discrimination or disrespect during pregnancy and childbirth. And that's probably the underlying reason. But they do keep pediatric appointments. It's not like they don't care about their health or anything. They just don't want to undergo the trauma of dealing with that, especially with a new baby. And so oftentimes they come to the pediatrician and talk about issues, especially related to their own health too, and related to mental health. And so it's an opportunity for pediatricians to get involved. And then the ideal postpartum care in a lot of developed countries is really like a home nursing visit. And I talk about this in some of the interventions in that lecture. This is a really, really successful model for improving health outcomes. So Black mothers in particular would benefit from better postpartum visits because they get C-sections more frequently. So they're more than 2 times as likely to be readmitted in the month following surgery. They also have higher rates of other chronic illnesses that really need to be observed and monitored. And then higher rates of postpartum depression, which increases poor outcomes for everyone. So when